Well, let's get the very latest. Let's speak to Julie Schindall from Oxfam, who's been working where the outbreak actually began and joins us on the line from the Haitian capital. And we're very grateful for your time here this evening. And just in the last 10 minutes or so, we've had reports from the AFP news agency quoting the UN Humanitarian Affairs Service saying that it fears that this cholera crisis could spread across the country, infecting tens of thousands of people. They acknowledge that the cases are slowing down, but say the UN could not afford to be complacent here. That's a worrying assessment, isn't it?
Well, I think what we really have to understand from that statement is that we're doing some very, very careful emergency planning here. We call it contingency planning, and this is simply saying that, look, if this gets out of hand, which we actually doubt that it will, that we're going to be absolutely ready. You know, Haitians have already faced far too many disasters, and as they're due. But I think that in Oxfam, where I was yesterday, we can actually control cholera very, very well. As your correspondent stated in the report, it's all about information. Basic personal hygiene practices are the way to prevent cholera. It's very simple, and we can reach a lot of people with those messages in a short period of time.
So the UN essentially talking about contingencies here. Tell us a little more then what you're doing on the ground.
Right. So as I was visiting our teams on the ground in Oxfam yesterday, we have done a soap, water purification tablets, and rehydration salt distribution yesterday and today. That reaches 40,000 people in a work zone we've been assigned to by the UN and government cluster system, which coordinates aid agencies. And we are putting out personal hygiene messages saying, you know, wash your hands, only eat cooked food, wash your hands after you go to the toilet particularly. Very, very good basic practices that every individual needs to practice. We've been disseminating those messages through radio stations reaching 100,000 people, and also through community mobilizers who we train to go back to their friends and neighbors to make sure that each individual, including small children, are following good personal hygiene practices.
If it did spread, it potentially could take in tens of thousands of new cases. If that was to happen, and I understand what you're saying about the contingencies here, how quickly does something like cholera actually move?
Cholera is a very fast-moving disease. It can reach people very, very quickly, but it's only if those people are not following good personal hygiene practices and if they don't have access to clean water. So, frankly, I saw the statement from the UN as well. I immediately asked our public health expert on our staff at Oxfam, and he said, honestly, you know, cholera can be stopped very quickly with information to the population. So I think that's really what we have to focus on now. And of course, yes, it's always important to do good planning in case of emergencies, but we really doubt that this is going to spread to tens of thousands of people, but we just simply need to prepare. That's what the UN is saying.
So your feeling on the ground is that you are getting on top of this now?
That is my feeling. I was in Oxfam yesterday. I visited 2 hospitals. The hospitals were very calm. I saw orderly rows of beds and IVs set up. We have some of the best medical and public health personnel in the world here because of people who were in place because of the earthquake response. And I do feel very confident, although for ourselves, you know, we are relying on contingency stock to respond to this, and we will be appealing for more resources so that we can respond to this. We need to be very ready because, yes, cholera is a fast-moving disease. And the most important thing is to move quickly and to inform people. And we cannot rest on our laurels. We have to keep moving forward as fast as we can to prevent the spread.
Well, Julie Schindall from Oxfam, thanks very much for your time. We're very grateful.